Section 1, foam rolling. Foam rolling is a great tool to use for what we call in exercise science self-myofascial release, which is fancy words for, hey, you can give yourself a massage. Now, I want to be very clear as a massage therapist, this is not a substitute for massage therapy, but more so a complement to it. So this will help you move better, but if you're looking for something more specific, go see a therapist. They'll be able to help you out with some of those tighter restrictions that you can't get to. But for this section, what we're going to go over is the foam roller and a lacrosse ball. The foam roller is something that you can order on Amazon. This is a 36-inch foam roller, standard size. And what this is going to allow us to do is help with increasing blood flow to specific areas, those that are primarily tighter in most people. And with the lacrosse ball, what this is going to do is more trigger points. So this is going to get into more specific spots that the foam roller can't reach. Foam rolling the adductors. To begin, we want to start with foam rolling the adductors. We want to have the foam roller in a vertical position, meaning that it's upright. From there, I'm going to straddle my thigh onto the foam roller, going onto my forearms. And from here, I'm just shifting my weight from side to side. Now, as I'm rolling out, I can turn my leg upward, I can lengthen it. You can play around with the position, but mainly just going from side to side. Foam rolling the quadriceps. The next area that we're going to go into are the quadriceps, which are the front of the thighs. What we're going to do here is we're going to start just slightly above the knee, going onto our forearms, and we're going to pull ourselves up and push ourselves down. And as I'm going through this motion, I want to make sure that I'm pulling my belly button up and I'm slowly dragging myself upward and downward. And when you do find those tight areas where there might be a little bit of a bigger knot, feel free to just hover above it and just scroll up and down lightly to try to move that tissue around as you see best fits, depending on the tolerance you have for that spot. Foam rolling the calves. With foam rolling the calves, I like to stack my legs on top of each other. From here, I like to start at the center of the calf. I'm going to pull my knee upward and downward and making most of the movement coming from my lower limb by bending my knee. Now, can I raise up and get more tension? Yes, but that does cause more stress on the shoulders and the wrist. So to take some of that stress out, you're going to keep our butt planted and pull that roller up and down and then switch to the other side. Something else to play with is turning your big toe inward to get more on the inside of the calf or turning it outward to get on the lateral side of the calf. Foam rolling the hamstrings. To foam roll the hamstrings, we want to place the foam roller slightly above the knee. Now we can raise our hips upward and we're going to pull ourselves downward and upward. Same thing here, I can turn my toes outward or inward, see where there might be more tension, or just keeping them neutral. Again, you're going down the outer edge of the hamstring more so, focusing on the back thighs here. Foam rolling the glutes. With foam rolling the glutes, we can do one of two positions. We can have our weight shifted to the side here, where we're rolling upwards and downwards, right on the edge of your pocket here. And if you want to make it a little bit more intense and if you have the mobility, the weight that you're shifting your hip on, you want to cross that same leg over the opposite knee. So here I'm on my right glute, so I bend my right knee and raise my right ankle over my left knee, rolling upward and downward here. Foam rolling the upper back. With foam rolling the upper back, we want to start slightly below the shoulder blades, right on the bottom part of our ribs. From there, we can place our hands behind our head. We can pull ourselves down and roll ourselves up. In this position here, I'm having my hips slightly raised up as I'm rolling upward and downward, keeping my hips leveled and really focusing on going throughout that tight upper back. Think about the hunchy spot when we're sitting over a computer all day. That's where we want to get into, is the thoracic spine. Foam rolling the lats. Foam rolling the lats is going to be a little more sensitive and difficult spot to get into for some, With this position, the thing to avoid is going onto the armpit. We want to avoid that spot because there's a lot of nerves and it's a sensitive spot to get into, and there's really no tissue there. What we want to do is get alongside the scapula and the rib cage here to get the lat and the posterior shoulder blade here. So I have one leg bent, which is my left knee. My right leg is straight. My right arm is raised upward. And I can do one of two things. I can just keep moving upward and downward. On the side here, if I want to make this a little bit more intense, I will raise my arm further up, or I can have it bent here to decrease some of the intensity of the motion. Next up is going to be lacrosse balling the upper body. So there's a few spots that we can get into, specifically starting out with the anterior part, which is the chest, aka your pec. So I want to go where my clavicle or my collarbone is, just slightly, about maybe 2 inches, and I'm just going to go side to side and up and down with the lacrosse ball on my pec. So I pin the lacrosse ball to my pec. From here, I'm going left and right, and if I want to change things up, I can go up and down. Another thing I can practice with this is I can find that spot where there's a trigger point where it's a very dense knot, and I can just move my arm around too. So I can move it upward, I can pull it back, I can bend my elbow, and I can move it from side to side. Again, feel free to play around with some of the ranges of motion using your arm in this lacrosse balling of the pec. Lacrosse ball, the upper trap. So using my lacrosse ball, I'm going to place it on the upper part of my trap here. So think right above the shoulder blade. Usually this is where people hold a lot of tension, their ears, their shoulders are usually up to their ears. So I'm going to place that ball in the back, and from here I can walk myself forward, so that way I'm at a slight angle, pressing in my weight into the ball, going left and right. I can go upward and downward. Again, sometimes that ball can be a little tricky. I can also add in some ranges of motion where I go out to the side and going forward. Lacrosse ball, the scapula, and the posterior deltoid. So the last area that we're going to work on is the back side of your shoulder and the shoulder blade itself. So we want to go slightly below the spine of the scapula and mainly focusing on the lateral edge of the scapula and the posterior side of the shoulder blade, the shoulder. So again, I'm going to pin that ball back there. I'm going to adjust as I see fit, and from there, I'm just going to go from side to side. I can go upward, downward. I can introduce some arm movements as I have before, playing around with different ranges of motion. But for me, going from side to side feels good enough.